Got it.
Okay, so little background on myself. I am the managing director for Franchise Benefit Solutions. I'll give you a little facts regarding Franchise Benefit Solutions. I have over 40 years of experience in the business. We've been working with the franchise community for about 35 years. We have over 35 years of experience specializing in the customized benefit programs to the franchise community. Our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Valpak, Comfort Care, Grocery Outlet, The Joint Chiropractor, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. So what makes us different? Obviously, we have an understanding of the franchise community. That's all we work with. That's our niche, and our name says it all. We focus on building a benefit strategy and developing a long-term relationship. We offer you, the franchisor, training and support for prospective franchisees when they come in. We offer an online quoting portal, which allows the ability to obtain instant quotes from multiple insurance carriers, because a lot of employers don't have time to speak to us, so they're able to go on to our online quoting portal, and we would provide you a branded web page linked to your corporate site, which outlines our products and services that are available. So why do clients choose us? Here's a few of our testimonials. The first from Valpak out of Virginia. The second, which happens to be one here in Michigan, is a sports club, part of the URSA Association. And the last here is a franchisee out of California through Grocery Outlet. Our advantages: we offer affordable group plans and rates, all with guaranteed acceptance and no waiting periods. Our plans and rates are the same no matter where your franchisees are located. If you have a franchisee in Florida, Michigan, Washington, or California, our plans and rates are the same. There are no participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. Franchisees choose the benefits they want to offer their employees, and employees can enroll online through our online portal. Our program portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Like I said, plans can be employer paid, standalone, volunteer, or packaged together through payroll deduction. So basically, the employer has the choice to however he wants to set up the program. We offer 3 health plan options: individual and family, comprehensive group health, and then our voluntary health, which is our most popular. Our individual and family health plan, for those employers that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. Once they input their personal information, which you can see here, they can compare affordable health plans from different carriers, find out if they qualify for financial help, because our portal is hooked up to the marketplace, so they can see what their monthly subsidy is. They can view benefits at a glance, view local providers, and apply online or download enrollment forms. So as you can see here, once they put their info in, they could, what comes back would be the benefit plans, it would be from the lowest rate to the highest rate. Just happens to be here, we're showing Michigan. And then you have your subsidy amount, and then the cost for the individual, which would include the subsidy. So this is on a individual basis, and they can look at it at their own time. If a franchisee is considering their group options, we can help them make the right decision that best meets their healthcare needs and their employees. Group plans are based on the demographics of their company, along with their employee and dependent ages. We would need a census information in order to provide them with a group plan. We offer ACA and non-ACA compliant plans. ACA compliant plans are community rated, while non-ACA plans are based on the demographics and medical history of their employees. Non-ACA plans can be much lower in cost than the ACA plans. So as you can see here, the ACA plans, which is since the marketplace came into being, require a minimum of 2 employees. Again, plans are community rated. They're based on the demographics, so we would need a census from the group. Carriers will accept eligible employee waivers, and plans are guaranteed issue, and these are no medical questions. The non-ACA, we need there's a minimum of 5 employees that are required. Rates are based on the group demographics, employee census, and medical history. So these plans, the non-ACA plans, were in being before the Obamacare, before 2010. So they're starting to become more prevalent now. But you can find a group out there that that doesn't have any health conditions. So carriers will not accept eligible employee waivers. So if there's 15 employees, they're going to require a minimum of 7 employees to enroll. We rarely enroll a non-ACA compliant group. Most groups that we enroll are going to be ACA compliant. So far, I've covered 2 of our 3 healthcare options: individual and family and comprehensive group health plans. Our third and most popular option is our low-cost voluntary group health plans, similar to an association plan. Our voluntary MEC and limited medical plans are all about access, easy, low hurdle access to a healthcare system, otherwise unattainable for many employees. The basic MEC, which you can see here, covers physicals only, covers 100% of any type of physical. Basically, I had a physical this morning, and I know that physical was probably $1,000. It's covered 100%. It includes a wellness exam, immunizations, any type of screening, blood pressure, diabetes, cholesterol, any type of screening, flu shots, colonoscopy, and mammography screening. So an average physical could cost $3,000 to $5,000 under the basic MEC, which is ACA compliant. It's covered 100%. As you can see here, the cost is $58. So we do find a lot of employer or franchisees will contribute. They'll pay for the physical because they want their employees to at least go have a physical. And that way they can see if there's any issues. So they will contribute towards the $58. As I mentioned, the basic MEC covers preventative services only, while the MEC Plus, Premium MEC, and the Super MEC plans cover preventative care, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. So primary care visit under the MEC, Premium, and Super is $15 copay, no balance bill, just like a comprehensive major medical. Specialist, $15 copay. Urgent care, $50, lab and x-ray, $50, and generic prescription, $15 copay. Does not cover inpatient, outpatient, or emergency services. But we'll get into towards the end of the presentation where we offer a hospital confinement plan that will help offset the inpatient, outpatient, emergency. So these plans here, the MEC Plus is $109. Most comprehensive plans are going to cost in the vicinity of $400 to $800, and again, it's based on age. So this is a quite a bit less cost. Our sales is probably around 80 to 90% on the MEC plans here. So the also included is our value added benefits, which is a cash benefit payout to the employee, which will help avoid the financial crisis. The member copays, under this program here, it's a member copay. There's no balance bill. Members would have to use a PHC network provider and excludes out-of-network services. So what's good about this program, there is no employer participation that's required or contribution that is required. So if the employer doesn't want to pay for it, strictly wants to offer it for the employee to pay 100%, they can do that. Doesn't matter what state the franchisee is in, it's the same plan, same rates for your franchise. We also offer a limited medical plan. The limited plan, similar to a MEC plan, otherwise this plan has balance bill. So if there's a $100 cost for the primary visit, the plan will pay $60 towards it. The employee is responsible for the balance bill of $40. But generally what we find is that the doctor or the primary care will ask them if they have insurance. They present the card and then they're going to sign it over to the provider. So the difference between the limited and the MEC, there's no balance bill. This plan, there is a balance bill. We do find that employers will offer both plans. They may even contribute towards both plans also. Now, this program here, the limited, does offer a little more services. It offers the lab test, outpatient surgery, anesthesia, hospital emergency room, urgent care, hospital room and board, hospital admission for specified conditions, and prescription drugs. And you'll notice here that the cost is a little less than the, let's say, the MEC Plus plan. But again, there could be a balance bill. So between the two, MEC plan, no balance bill, limited medical, balance bill. Additional plans that we offer 4 dental plans. The advantage of our program is our dental plan has no waiting periods. So if a group came to us on, let's say, the 30th of the month and said we wanted to cover the day one, April 1st, we have no waiting periods. The employee can go visit the dentist. And most dental plans have a 12-month waiting period for, let's say, major services. We have no waiting period, so we'll cover from day one. Vision, we offer 4 plans, 2 plans from VSP and 2 plans from IMED. Both are the #1 and 2 plans in the country. So all 4 plans have a $10 eye exam and a $25 lens frames copay. The difference is going to be in the for the glasses, for the lens frames, where it could be every 24 months, every 12 months. IMED has a program where every 12 months for the lens and 24 months for the frames. Life insurance.
What are the costs on those for the user?
Probably around $5 a month. It's pretty cheap. You're wearing glasses too. So there's also a maximum that it will pay for. I know my glasses are probably $300-400, and I think it paid probably $150, $175 towards it. So then I just paid the balance. Life insurance, we offer 2 plans. One is employer pay, $10,000. The other is a voluntary plan, which is employee pay. Employee can purchase up to $150,000 on themselves, $50,000 on the spouse, and 10,000 for children. All guaranteed issue, no medical questions we take from day one. We offer telemedicine plan, which is becoming a mainstay, a big portion of our enrollment. Let's say you're at work, you feel sick, but you've got so much work to do, you can't leave. You call the doctor, you provide them with your symptoms, they'll give you a diagnosis, and our program will even call in a prescription. Mental health benefits is covered from beginning of this year, January of this year. You can connect by phone, video, or app. My family has it. My son had something in his eye, uploaded a picture, doctor looked at it, and then called in a prescription for him. It's the cost is around $11 a month, and it covers up to 5 members of a family. We have an accident benefit that pays for both inpatient and outpatient treatment of covered accidents, covers more than 50 benefits. It also provides a lump sum payment for fractures and dislocation. Guaranteed issue, no underwriting, no health questions, and we've had the same plan and rates since 2014. Critical illness, we have 2 benefit amounts, $20,000 for the employee, $10,000 for the spouse, covers 20 covered illnesses, and we pay on the day that the illness is diagnosed. Children covered at no cost at 25% of whatever the primary insured their amount. Hospital indemnity, this is the one I mentioned to you that a lot of employers will offer this along with the MEC plans. Covers both injuries and sickness. It pays an admission per day hospital confinement. Covers outpatient medical treatment received in an emergency room or the doctor's office. Surgery and anesthesia benefits are covered, as well as diagnostic testing and prescription drugs. So we offer 2 plans. Generally, what we find is these voluntary group plans, the employer will not contribute. The employee will contribute 100% of these plans, but most employers will offer these plans. So we also offer a short-term disability, 3 monthly options that the employee can choose, $500, $1,000, or $1,500. The plan pays 60% of whatever the benefit the employee selects. The duration is up to 6 months, and there is a 14-day waiting period before benefits of sickness or accidents begin. We do find that employees will call us and say, hey, we had COVID, we've been out, but they didn't realize there is a 14-day window before the benefits will begin. And then we also have a free benefit to the franchisees. It's a prescription mail order through the Canadian Med Store. It saves the employee 80% on prescription medication, and it's for a maintenance drug for 90 days supply. I know this works. We've had calls where, for instance, I had someone call and said they were paying $1,400 and they were able to get it down to $400 a month. So I know this program works. Additional services we offer: consolidated billing, online HR services, Section 125 premium only plan, which allows the employer to deduct employee contributions. And we also offer COBRA administration for the groups that have over 20 full-time employees. Our benefits enrollment platform, from the beginning to the end, our benefits enrollment platform includes 4 steps from the initial contact of working with the franchisee to the enrollment. Step 1 is our discovery. The first step is to identify the employer's objectives of offering benefits that reflect both the employer and employee needs and their budget. We will gather the group information, discuss the employer's goals, benefit options, and their budget. Step 2 is the analysis. This is where, once we get the information from the employer, this is where we go into our own and we obtain quotes. So it's important for the employers to be strategic when deciding what to offer. We will review benefit options, costs, and help set up benefits program that will help the employer attract and retain employees. Step 3. So once the employer decides to go with us, would be step 3 is the communication. So the communication strategy is a critical component to the benefits planning and management. We will develop easy to understand benefits communication for the employers to share with their employers. So we would put together an employer guide or a easy to understand communication. This happens to be a communication where it's a 1-pager rather than a 10 or 15-pager, depending what the employer is looking for. And finally, step 4 is after we provide the employer with the communication, we build out a enrollment platform. So it's an easy online platform. Our online enrollment helps employers spend less time collecting and reviewing forms and communicating benefit details. For employees, they can select the benefit options best suited to their specific needs. So we would set up the online enrollment platform, send the platform over to the employer. Once they send us the employee contact info, we upload it to the system. Then we send out login information to the employees where they enter their demographic information and then go through the enrollment process. So we offer one application, one bill invoice, one online enrollment administration system. So as you can see here, from the beginning of speaking with the franchisee all the way through the online enrollment process. So looking ahead to 2023, I know we're only in April, but we actually start looking at 2023 around July. And we start announcing our program September, October. There are 2 types of enrollment, or group enrollment, special enrollment. First would actually be the individual, which is the Obamacare, the marketplace, which you should be well aware of. The second is the group special enrollment period. This is where most employers do not know about it. And the insurance carrier, believe it or not, don't want you to know about it. And the reason is because it's under the ACA, carriers are required to offer an annual group special enrollment period to employers who do not meet participation or contribution requirements. So if we had one of your employers that came to us today and said, I have a 25-man group, I'm looking to put a comprehensive plan in, they are required to have at least 50% of their employees participate. I guarantee you, most of your employers probably would not be able to afford it, like you said at the beginning. So that would be the contribution requirement. Participation, they're going to need at least 50% of their employees to enroll. Under the group special enrollment period, which is a 30-day window from November 15th through December 15th, there are no requirements. So they can enroll, all we need is 2 employees. So there could be the husband and wife, which is considered as one, and then one other active employee. We have a group, we can enroll them at the end of the year. Believe it or not, this is our accounting season. Just like accountants, they have the 30-day window to get all their IRS info in. Same with us. Ours is November 15th through December 15th. We enroll most of our groups during that 30 days. So again, 30-day window, no participation or contribution requirements, and we only require 2 full-time employees.
That's interesting.
Yes. What are our most popular solutions to help your franchisees hire and retain employees? So over the years that we've been working with franchisees, these are the top 4 packages that we find. The first one, the employer offers a dual MEC plan. Remember, I went over the MEC plans, and they contribute towards the employee-only cost. So generally what we find is that the employer will offer, let's say, the physical-only plan along with the MEC Plus, which is a $100 plan. And then they may select one other additional plan. So the employee contributes the balance of whatever the employer cost plus dependent cost, and if they're going to buy up. The employer then offers voluntary benefits at 100% employee cost. So as you can see, in bold, the hospital confinement, they would offer that as a package with the MEC plans. And then they would offer the voluntary benefits at 100% employee pay. So that's our most popular package that franchisees purchase. Package 2, and this is at the special enrollment period, the employer enrolls in a management only. So they've got the ownership and then they've got the management or the administrative office. Let's say there's 25 employees and there's only 3 or 4 management. This is how they would set this up. So they would offer a comprehensive plan for the ownership and management. Obviously, the owner is going to pay 100% for the ownership and then 50% for the management. Then the employer offers the voluntary benefits to non-management employees at 100% employee pay. So for the management team, they offer comprehensive, and for the non-management, then they offer the voluntary benefits. Package 3, employer enrolls a comprehensive group health plan. Employer offers dual medical option and contributes 50% of the employee cost of the lowest plan. So they're going to offer, let's say United Healthcare, they'll offer 2 plans. They'll contribute towards the lowest plan, allow the employee to pay the 50% of the single rate, and then any buy-up, and then 100% of the voluntary benefits. So again, all our voluntary benefits, as you can see here, the employee pays on their own free will. In package 4, the employer does not contribute at all. They offer 100% of the voluntary benefits and the employee pays 100%. Okay. So also what we do
with the employer contribution, is there like a range or an average that you see on what employers are contributing?
Yes, we'll see anywhere from they don't contribute at all, or they will contribute, let's say 50% of the MEC plan, which is $50. Basically, it'll pay for the physicals.
Okay.
So they'll pay for the basic MEC plan and then allow the employees to upgrade.
Okay.
Also, we offer you, the franchisor, training for prospective franchisees. Many prospective franchisees come from the corporate world and aren't trained on how to run a business. We help you educating your prospective franchisees with why they should offer benefits to their employees and help them set up a strategic benefits plan. In today's hiring market, a benefits package is essential for, excuse me, attracting and retaining top talent. Once franchisees have a great employees on board, they want to keep them from jumping ship. So we help you with the back office. We find that a lot of our franchisors don't really get into this. So this is where we help you on that end.
Yeah, we would want you guys to obviously manage us with the franchisees. This is just something that we'd want to present to them as like a value add to them. One of my questions that I have with the plan, I know you would probably work with a broker and they would determine like who the insurance is through, or is there somebody that it's through, like, you know, United Healthcare?
We actually we have our own sales staff because these
Mm-hmm.
plans are exclusive to you. We don't go through local brokers. We've also had local brokers try to work with us and sell the plan, but believe it or not, they try to take the business from us because they think they know how to run it. But eventually it comes back to us of what has happened. The one thing we find is the franchisees are a tight-knit community.
Mhm.
They speak to each other. So our business comes from referrals. So if we find where, you know, the local broker try to go on their own with this, it'll end up coming back to us.
Okay. With the benefits and finding like doctors, dentists, whatever, is there like a website that the employees would be able to use to find who was closest to them that they could go visit?
Yeah, so when they go through the enrollment process,
Mhm.
part of the enrollment process, there's links to the local providers in their area. So
Okay,
each plan is going to have the providers in their local area. In addition, there'll be plan summaries in there that they can download the plan summaries and review them from the carrier.
okay,
Okay, so the project scope and timeline to set up a program for you is we would develop a program brochure, set up the branded page, provide online quoting engine, the portal, develop additional marketing resources for you, and also include a introductory webinar for your franchise system. And then if you have different brands or the different types of franchisees, we could set up different webinars for them. And then we'll also work with the franchisees. So if they want us to provide a webinar for their employees, we'll also do that. So the timeline is around 2 to 4 weeks to set up a program. Here's what our branded page would look like. We've set up as you can see here, the MEC and the medical plans. So we would set this up for each plan, and then they can go through it at on their own. So what we've done in the past with our franchise systems, like I mentioned at the beginning, the recording here, we will send to you. You can share it with your advisory committee. And then if you'd like, you'd want to set up a test pilot program where we would work with a few of your franchisees, we'd be happy to do that. And then obviously they would report back to you, and then we can work from there.
anything we have to do on our end? Is there any contract that we have to sign for you through OpenWorks? Like I said, we want to be involved as little as possible with the insurance because this is their employees, not ours.
Correct. And to be honest with you, we do have a few contracts with the franchisor, and I think we might only have 2, but for liability reasons, most of our franchisees do not want to be involved because, like you said, they're the employees of the franchisees, not of yours. So we do work with the franchisor when it comes to the marketing side of promoting our program. Other than that, no. You don't want to be involved, and we suggest you not be involved either.
Perfect. That works for me. Great. And
Okay.
that would be one of the things that you would work with me to get information out. And so I would love to have this recording if you could send it to me, because I would love a couple of franchise advisory board members I know are very interested in this. So I'd love to be able to send this to them to get their feedback on. And then we can discuss next steps from there.
Okay, let me stop this here. Okay, let me